parents still fear the idea of ADHD medication, afraid that their child will be dependent on it. What do you say to that?
Well, I think I understand that that's how a lot of people feel. The reality is that people don't become dependent on ADHD medications. The way that we use the medications, the doses that we give, and actually the actual medications that we're using are not ones that actually people will become dependent on. And I think that the risks and benefits of medication, for me it's actually quite clear that the benefits very much outweigh the risks. That's not to say that nobody ever gets side effects. People do get side effects from medication, but almost all of those we can manage. And if someone's side effects are not tolerable, then we can stop their medication. And not becoming tolerant to the medication and not becoming hooked on the medication actually means we can stop them that day.
That's nice. For families with limited access to specialists, what are the most important signs that they should look for before seeking medical help?
Well, that's a really good question. So first, if we're talking about ADHD, then we're talking about the core symptoms of ADHD, which are difficulty concentrating, and that can include difficulties with long-term focus, difficulties with organization, difficulties with forgetfulness. And then on the other side, difficulties with overactivity and what we call impulsiveness. Act now, think later. And so these are the core symptoms that people should be looking out for. But actually they also need to think about how are these interfering with my child, with this person's day-to-day life. And so asking the question, how much impact are they having? Where are they having an impact? Is this something that we see at home and at school and usually at play as well? Or is it just restricted to one situation or the other? Where it's just one situation, then sometimes there are other explanations. So if that is the case, think about, are there reasons why this is happening in one place and not the other? And if so, think about managing those.
Okay, right. What's your advice to teachers or caregivers who think a child is just naughty or lazy, not someone who needs help?
I think again. And so that's my first thought, is that there are children who are just naughty, but actually thinking about, is this child behaving this way for a meaningful way because they're trying to get out of something or show me something, or actually are they trying? And so talk to the child. Talk to the child and find out if they have an explanation about why. I think jumping to conclusions that this is just about bad behaviour can be quite dangerous for kids, because we miss those kids who actually are really trying hard but struggling to keep up.
Okay. All right. Just a general advice to the Malaysian public. What would you say?
Well, I think that you should always, if a child or an adult even is having difficulties, and those difficulties are with focus, with activity levels, or with impulsiveness, then think about, is ADHD part of their problem? I wouldn't jump to conclusions that ADHD is, and then seek support, seek help from whoever is closest to you to give you that advice.
I think it's a good question and something that comes up a lot in terms of clinical practice. I think one of the things that can be most helpful for parents is providing education around the diagnosis and being very clear that it's not about blaming them. It's not their fault. The child is not having a diagnosis as a result of their parenting, and being very clear about why the diagnosis was provided, what factors can increase the likelihood of someone having ADHD, but really trying to reframe it to parents that when you're parenting a child who has additional needs, it absolutely makes sense that they may need some additional support as a parent. So trying to kind of soften the language around that, but also acknowledging from the start that blame and guilt and shame is a normal reaction to parents finding out news about their child. However, it's not kind of our intention, and to kind of move away from that language is probably my best suggestion.
How do we deal with those parents with denial?
Denial is a hard one. I think, again, I'll come back to education and being very clear in our role as a professional as to why we believe and have diagnosed the child with something. Because if we can be very clear about the problems that we're seeing, the reasons why we've made a diagnosis, how they can get some additional support, we're the ones who have kind of the training and the expert knowledge in the field. If we can help parents to understand, to develop more insight into it, that generally helps to shift the sense of denial, or maybe not really understanding the disorder. A lot of the time, denial, in my eyes, is because of a lack of information and not really understanding what might be going on. So it's not that it's anyone's fault, it's just that they don't have enough information to kind of make an informed decision.
Okay, all right. Okay, how can therapy help children with ADHD, especially when some parents, they think therapy and counseling are for those who are, severe?
Yeah, I guess my first response to that question is that therapy and working on your mental health is helpful for everyone, regardless of your age, what's happening in your life. As a psychologist, I think it can be helpful for everyone. However, what we know is that most of the time people don't seek out help for their mental health unless they're struggling. That's generally when most people do present to mental health services. So I suppose in terms of helping parents understand if their child does have a diagnosis of ADHD, it's helping them to understand that their child has different ways of seeing the world, of coping, of kind of managing their relationships, of how they perform at school. So they might need some extra tools and tricks of how they might need to kind of manage their behaviour. And it's not about there being a big problem. We're working on identifying ways to help their child cope. And these can be not only at school, but at home, in their relationships. And we try to make it fun for kids. We know that kids need more play, to be more creative. So if we can work with them to set up sessions for it to be enjoyable, that helps kids to feel like they can come along and have fun. Of course, we also talk about some hard things, but it's a balance with kids. It's not all talking about difficult things. It's giving creative, helpful ways to help them manage their emotions, improve their relationships, things like that.
Okay, talk about emotional regulation kind of thing. What are some simple techniques that you can share with us, or routines for parents and teachers to support kids with ADHD?
Yeah, good question. I think there's quite a few things that can be done. Some simple ideas that come to mind are using kind of ranking questions, or, with a child we might use something like a thermometer. 0 is feeling cool, calm, collected. 10 is either very angry or very anxious or very sad. And so using numbers can help parents and children have a shared language of where the child is sitting. So if a child says, I'm at a 9 out of 10, I'm super angry, then everyone knows the child's quite overwhelmed and they're struggling. Whereas if they're at a 2 or a 3, things are kind of going okay. So the benefit of having a simple kind of ranking question can be that kids then learn when they're feeling overwhelmed, or if they're going to explode or become very angry, the numbers can be kind of helpful. The other one with ADHD, I suppose, or not even ADHD, any child, is a traffic light system. So red is stop, orange is think about what needs to happen, and green is kind of make a bit of a plan. So often people will have visual images around the house or on their phone or something about holding in mind a bit of a traffic light about next steps.
So the kids will kind of like choose the lights.
Yeah.
Their level at the moment.
Yeah, that can be to do with regulation, or it can be about problem solving. So, yeah.
Is it normal for ADHD children to feel anxious, moody, or misunderstood? And how can we adults respond to their emotional?
I'd say any child feels all of those emotions and they're normal. And I think the biggest thing is normalizing and validating any and all emotions, because not only children but adults experience all these emotions every day. And so I guess the first thing is about noticing and acknowledging that there is a feeling. And then with children, it's about helping to be more active in supporting them to manage their feelings. So whether that's giving them choices, helping them to calm down, whatever it might be. But that's really what I think the role is.
Okay, this is one personal question from me.
That's okay.
With you. Because sometimes we parents, we have a lot on our hands.
Yes.
So sometimes we don't have the capacity to, just focus on one child at one time. What are your tips for parents like me who have to handle a lot of children at one time?
I think it's a very kind of normal experience for parents. And I think the biggest thing is normalizing that parents are absolutely trying their best. They have a lot to juggle, and it's not about anyone not doing a good enough job. So I think it's about giving people permission to say that they're absolutely trying their best, and you can only do what you can do. So giving yourself kind of permission to say it's okay and that you're trying your best, and you're not going to get it right all the time, but no one does. You're human. Everyone makes mistakes. But so long as you're kind of aware of them and working towards trying to meet the needs of your child, you're doing more than enough.
Okay, one last question.
Okay.
What is your message to Malaysian? Just a general, about ADHD. What is your, your final words for Malaysian?
There's been lots of really positive things that are being implemented across Malaysia from what I've heard across the 2 days of this workshop. However, it also seems like there's lots of work that's still to be done, and I think the biggest thing that will be helpful for Malaysia moving forward is more public awareness, understanding and education, because once people know more, then they have more opportunities to do something different, to develop more resources, to ensure there's more collaboration. So education, helping people understand more, that's probably my biggest message and hope for the future.
Thank you very much.
No problem.
And that's what we're doing.
Ah, great.
Thank you.
Thank you.